Sorry, I can't come in today. I have a fever. There's a sick irony in healthcare today. The very culture meant to heal is making its own healers ill. And when nurses actually get sick, they're punished for it. Picture this. A nurse wakes up with a 102-degree fever after a week of caring for patients with flu, RSV, and COVID. It's respiratory season, after all. They've been wearing N95s, following isolation protocols, but with a unit full of infectious illnesses, it was almost inevitable. In any other profession, the answer would be simple: stay home, rest, don't infect others. But in nursing, that phone call becomes a nightmare. First comes the guilt trip from management. Are you sure you can't make it in? Your team really needs you. You know we're already short-staffed. Your patients are counting on you. Then comes the retaliation. Suddenly, your weekend schedule gets worse. Your requested days off are lost. You're assigned the heaviest patient loads when you return. Some facilities even use occurrence points systems, tracking sick calls like demerits, regardless of whether you had a doctor's note or legitimate illness. The hypocrisy is stunning. These are the same hospitals with posters about infection control and employee wellness. The same managers who preach about self-care are the ones pressuring nurses to work through illness, injury, and exhaustion. Let's be crystal clear about what this means. Nurses working with fevers because they fear retaliation. Healthcare workers hiding symptoms to avoid points on their record. Staff pushing through illness until they literally collapse. Contagious diseases potentially spreading to vulnerable patients. And here's the darkest part. Many hospitals know exactly what they're doing. It's cheaper to guilt a sick nurse into working than to maintain adequate staffing levels or pay for coverage. Consequences? Nurses working sick make more medication errors. They're more likely to get injured. They take longer to recover. And yes, they can infect their patients, the very people they're supposed to protect. Remember, every time a nurse is guilted into working sick, it's not just their health at risk. It's every patient they care for, every coworker they work alongside, every family member they go home to. This isn't just a nursing issue, it's a public health crisis. Subscribe to learn more about these systemic issues and how we can fight back. Because until we change this culture, everyone's health is at risk. The diagnosis is clear. The prescription? Change. Systemic change. Because right now, this toxic culture isn't just making nurses sick, it's killing healthcare itself.